Zoom to go on to live. This webinar is being live streamed. Okay. Back over here to you. Got it. Okay, we have some attendees that are here. Thank
Okay.
you all for attending tonight. We're about to start. Give me 1 second.
Hi, everyone. Welcome. Good to
Stop that.
I'm like, don't start yet. Hold on, I'm sharing it on social media. I think it's still playing. Okay, that's your list popping up, Dr. Pugh.
Yes. See, we've got Annette and Zach
And Jordan.
and
Okay,
Jordan.
so you got to take your list off of the screen because everybody can see it.
Do you want me to do the list on the in the background since I'm not showing the screen?
Yes, please.
Yes,
Okay.
please. Here, I'm going to share this document with you, okay?
She's already on
Oh, I
there.
have. Yeah.
Just take it down, Dr. Pugh. She has it.
Okay. And so you just want me to keep an eye on the participants?
Yes.
Okay.
Okay, you have to come off of that also so I can get started.
Sure.
All right. In the video.
Yeah,
Good
I got
evening, everyone. I'm Ivanka Hall, Executive Director of the Northeast Ohio Black Health Coalition. We are the first coalition in the state of Ohio to focus exclusively on African American disparities. Our mission is to create equity by addressing the cumulative impact of racial, economic, environmental, and social justice inequities in the African American community, or in our case, our communities of concern. Tonight, we're here to talk about asthma, and not just about asthma, but about what is going on in Mahoning County. I'm going to have Dr. Pugh introduce herself, and then I'll talk a little bit about what's going on in Mahoning County, and then we will show a video. Dr. Pugh.
So, good evening and welcome. My name is Dr. Lachelle Pugh. I'm the Assistant Executive Director for the Northeast Ohio Black Health Coalition. We thank you all for being here this evening and hope that you will find this presentation informative. Thank you for joining us.
Thank you. So one of the reasons that we're here, a few of the reasons that we're here, is because the Asthma Minority Outreach and Engagement Project with the Ohio Department of Health, their asthma program, is working to engage communities that are within the highest burdens of asthma, and basically to educate the providers about resources that are available. One of the resources is this toolkit that we have. We created a toolkit for you. So if you need a toolkit for yourself or for your organization or for your church, we have a lot of nurses groups that have asked for it, some summer camp groups. This is the toolkit. It is a folder that is filled with information that you can use. to talk about asthma. The other is that part of this program is working to organize local communities in programs like this that are specifically tailored towards the African American community. One of the things that we do know about the key findings of the Ohio Department of Health is that Black adults and children in Mahoning County have experienced higher rates of asthma hospitalization and emergency department visits compared to their white counterparts. During the 2016-2021 surveillance period, so the period where we've been monitoring female adults and male children in Mahoning County typically experience higher rates of asthma hospitalizations and emergency department visits compared to their respective gender counterparts. And during 2016-2021 surveillance period, Black adults in Mahoning County experienced death rates significantly higher than their white counterparts. And so it's important for us to understand that the reason that we are here today is because of the high hospitalization rates of African Americans in Mahoning County and the high number of death rates that we have experienced in these particular counties. Some of the things that we should talk about when talking about asthma is we talk about some of the other health conditions that are associated with asthma. And so one of them is obesity. We know that 1 in 2 adults that currently have asthma are obese versus 1 in 4 adults that currently have asthma that have normal weights. The other thing is depression. Adults who currently have asthma are 2 times more likely to be diagnosed with a depressive disorder compared to adults who do not currently have asthma. The other is COPD, which we talk about in our communities quite a bit. We have a number of community members that have been long-term smokers or worked in different factories. And so now they're experiencing COPD. COPD for adults who experience current asthma are over 4 times more likely to have been diagnosed with COPD compared to those who do not currently have asthma. I talk about COPD because a few months ago, I lost my aunt who was a chronic smoker who suffered from COPD and asthma for a number of years and succumbed to those illnesses. Adults in their lifetime, particularly for African Americans with asthma, about 17.9% of adults in our lifetime experience asthma. Childhood lifetime asthma for African Americans, about 15.6%. And so looking at some of the other things is, and for the state of Ohio, we know that 1 in 10 adults currently have asthma. And 1 in 12 children are currently being diagnosed with asthma. Over 25% of adults have missed at least 1 day of work due to asthma, and over 20% of children have missed at least 1 day of school due to asthma. Nearly 48% of adults limit their activity due to their asthma, and about 33% of children limit their activity. About 14.5% of adults have been told at some point in their life that they have asthma. One of the things that we should know about asthma is that asthma does not go away. So you may have asthma when you were a child and feel like, okay, haven't had any more attacks at all. And so what we do know is that you cannot outgrow asthma. So what'll happen is you may not have as many attacks, but the probability of you experiencing an attack is relatively high, particularly when we have areas that have poor air quality. Mahoning County is one of those areas. Lorain County is another. The other is Cuyahoga County. Right now, while we're doing this, I am currently experienced an asthma attack myself. So I just had to tell my team that I have been having some asthma difficulties over these last couple of days. And the other thing that we talk about when we talk about asthma is smoking. The dangers of firsthand smoke that is being inhaled by the smoker. Secondhand smoke is exhaled by the smoker and released from the end of a burning cigarette or in a vaping device. Thirdhand smoke, which we don't talk about as often, which is this toxic residue that we leave on teddy bears, our stuffed animals that we have for our children, that's on our clothes, on our couches, furniture, in our car. And so that means that when other people come in contact with those things that we have had in our personal space, that it can also trigger their asthma. And so that's important for us to remember as we're working through this process. Dr. Pugh is going to show you a video as soon as I'm finishing talking about this is exhale strategy. So we have these 6 strategies that represent the best available evidence that we have to control asthma. And so one of them is education. That's tonight, our education on asthma and self-management, extinguishing. So extinguishing smoking and secondhand and third-hand smoke. Home visits for trigger reduction and asthma self-management education. So making sure that you understand what's going on in your home. Achievement of guidelines-based medical management, making sure that you're going to your doctor, that you have the refills that you need for your inhaler, particularly now when we have these ozone action days. The linkages and coordination of care across all settings, making sure that all of your doctors understand what's going on with you and your asthma, and environmental policies and best practices to reduce asthma triggers, indoor, outdoor, or in the occupational setting. Some people are exposed. They may have a flare up at work because of the type of work that they're doing, particularly people who are working in factories or in closed-in spaces where there's not a lot of air circulating in. And so for us, these things are important, and it's important for us to know that that's why the Asthma Minority Community Engagement Project is so important, and our work that we're doing to educate you is so important. So we want this to be a time where we help you to become fully engaged about the issue around asthma, and we're going to show you a video, and then we're going to see if you have any questions.
The Health Equity and Outreach Program Manager with
Make
the
it bigger.
Asthma and Allergy Foundation of America. And my colleague here is Jessica Jackson, who's AFA's Asthma and Respiratory Health Program Manager. And we are going to talk with you a little bit today about asthma self-management. Okay, here's our quick agenda. We're going to talk briefly about some facts, some things about health disparities, some asthma basics, some tips on how to manage asthma and avoid triggers, some resources, and where to submit questions. So if you're not familiar with AFA, we are a national patient advocacy organization, was founded in 1953. We're the leading patient organization for people with asthma, allergies, and the oldest asthma and allergy patient group in the world. Our mission is dedicated, AFA's dedicated to saving lives and reducing the burden of disease for people with asthma and allergies through advocacy, education, research, and support. So, going to talk with you a little bit about some asthma facts. So, asthma is one of the most common and costly diseases in the United States. Over 27 million people in the US have asthma. This is about equals to 1 in 12 people. It's a leading chronic disease in children. About 4.5 million children under the age of 18 live with asthma. It's more common in male than female children. And non-Hispanic Black children are nearly 2 times more likely to have asthma compared to non-Hispanic white children. Adults, some asthma facts for adults. So 22 million US adults aged 18 and older have asthma. And asthma is more common in the adult population in females. So it's flipped than males, 10.8% of versus 6.5. And asthma rates are highest in American Indian or Alaska Native adults in the US. This is a slide discussing the burden of asthma on the Black, Hispanic, and Indigenous individuals in the US. Unfortunately, the burden of asthma falls heavily on these communities, and they're at the highest risk of asthma rates, hospital visits, and deaths. Black people in the US are nearly 6 times more likely than white people to visit the emergency department due to asthma. So AFA knows that this can help us shape how we approach health education in all communities. And we work on policy changes to ensure equitable access to things like healthcare and other resources. Talking about health disparities, we know the health disparities result from a series of factors, many of which stem from environmental or social injustices. So racial and ethnic disparities, they're complex and they vary across levels of social structure and genetic factors. Things like unequal distribution of stressors in people's environment. So things like living in poverty, not having access to good housing, not having access to things like quality health care, things like that can be part of those systemic injustices that I mentioned, and racism that has been deeply ingrained in the US policies and culture. Um, Things like we referred to some of in the healthcare space, you might hear the term social determinants, and those are listed on your slide there. And it's speaking about situations that people are born in that determine health status, things like education, whether people have access to healthy neighborhood and social support. Looking at the environmental conditions that contribute to health disparities, hazardous environmental exposures are a growing concern, especially in light of climate change. So exposure to hazards can have a significant impact on health conditions like asthma. The risk of exposure to environmental health hazards depends on where you live. So some communities, such as low income or communities of color, are more likely to reside in neighborhoods that were founded on racial segregation and other environmental justice. So many economically disadvantaged communities are in close proximity to industrial and hazardous waste sites, for example. And these sites are known to release toxins and contaminants that disproportionately burden those surrounding neighborhoods living in that community. So that increases people's exposure to environmental health hazards, which enhances the risk of poor health outcomes. So talking about health equity, that was a lot of discussion about the concept of health disparity. So flipping it, health equity is really what AFA is committed as a core value to improving, and it's a mission critical priority of the organization. So health equity is a state in which everyone has a fair and just opportunity to reach their highest level of health. And we as an organization know that it requires strong, coordinated efforts in communities nationally, locally, working on policies, systems improvement, and reducing and eliminating personal biases that are causing harm to many communities. So we're going to talk a little bit about asthma basics. I'm going to hand this over to my colleague Jessica, who will share some general information about asthma.
Great. Thanks so much, Lynn. Yeah, so first I'd like to just share some information about what asthma is. So essentially, asthma is a chronic lung disease that causes inflammation and also narrowing of the airways. And this inflammation and narrowing can lead to asthma symptoms, which can be any combination of coughing, wheezing, shortness of breath, and or chest tightness or pain. So unfortunately, there's no cure for asthma, but it can be controlled with the right combination of medications and trigger control strategies. And when these medications are taken properly as prescribed, and also when triggers are controlled, most people with asthma can actually live a healthy and active life. So a lot of factors have been linked to an increased risk of developing asthma, but it's very difficult to find a single direct cause. However, it does appear that asthma is more likely if someone in your family also has asthma, especially if that person's a close relative, like a parent or a sibling. Asthma is also more likely in people who have other allergic conditions like eczema or rhinitis, which is just another name for hay fever. Additionally, urbanization, it's associated with an increased asthma prevalence, and this is likely due to multiple lifestyle factors. And events in early life can also affect the risk of asthma. So essentially, it impacts the developing lungs, and this can increase asthma. And these factors include low birth weight, prematurity, exposure to tobacco smoke, and other sources of air pollution. And it also includes viral respiratory infections. And so exposure to a wide range of environmental triggers such as allergens and irritants are also thought to increase the risk of asthma. And this includes indoor and outdoor air pollution, things like house dust, molds, occupational exposure to chemicals, fumes, dust, and other triggers. And then finally, children and adults who are overweight or obese, they're also at greater risk of developing asthma. So with asthma, there are three main changes that take place in the airway. So first, asthma causes inflammation, and it also causes an overproduction of mucus inside the airways. And this in turn, it causes the airways to become overly sensitive or hypersensitive. And this hypersensitivity makes the muscles that are wrapped around the airways spasm. And this is known as bronchospasm. So the inflammation, the overproduction of mucus, and the bronchospasm causes the airways to become very narrow, and this narrowing leads to asthma symptoms. So fortunately, even though there's no cure for asthma, it can be managed with three steps. First, avoid asthma triggers, so the things that make your asthma worse. Second, take medications to prevent and control your asthma symptoms. And then third, you want to treat your asthma episodes if they occur. And we'll discuss this more throughout the presentation. So people with asthma, they have airways that are sensitive to certain things that might not bother people who don't have asthma. And these things are called triggers, and they vary from person to person. So when a person with asthma is exposed to something they're sensitive to, this causes an inflammatory response inside the lungs. And this inflammatory response again leads to asthma symptoms. And so examples of common triggers include allergens, and this can be things like pollen or dust or mold, animal dander. Irritants can also trigger asthma, and examples of irritants include smoke, chemicals, perfumes. Another very common trigger is respiratory illnesses, things like colds, the flu, and additionally, strong emotions, exercising, weather changes, or extreme weather, and GERD, which is another name for acid reflux, can also cause asthma symptoms. And other less common triggers include foods, especially those that contain things like sulfites. So an example could be like wine or sometimes foods like shrimp or dried fruit. Some people are also sensitive to certain types of medications, like NSAIDs. And an example of an NSAID would be something like ibuprofen. And then others can be sensitive to certain types of heart medications, like beta blockers. So in general, it's really important for people with asthma to avoid their triggers, and you can do this by adopting multi-component strategies. The one exception to this, though, is exercise, in the sense that it shouldn't necessarily be avoided. So usually providers will have people with exercise-induced asthma, or it's also called exercise-induced bronchoconstriction, pre-treat with a medicine, usually about 10 to 30 minutes prior to exercising or being physically active. So there are many medications that can treat asthma, and they're divided into three main categories. So first, there are controller medications, which your provider may have you take daily, even if you aren't necessarily having symptoms. And controllers, they address the underlying issue of asthma in the sense that they reduce the inflammation and the overproduction of mucus inside the airways. And controllers typically work very slowly over a long period of time. And then quick relief medications, these are used as needed. They don't address the underlying issue of asthma in the sense that they don't really do a whole lot for the inflammation and the overproduction of mucus inside the airways. They do, however, temporarily relax the muscles that are wrapped around the airways. And when those muscles relax, this pulls the airways open, which creates a much bigger space to breathe inside the airways. And so quick relief medications, they work very fast, but they don't last long. So typically their effects last about 1 to 4 hours, depending upon the person. And then finally, there are combination medications that aim to both control and relieve. And this is called smart therapy. And we'll discuss that more on the next slide. So essentially, smart therapy, it combines controller and reliever medications into one inhaler. And again, it can be used to both prevent asthma symptoms or relieve them. And two examples of these types of medications are Symbicort and Delura. So these are both inhalers, and they have a combination again of controller and reliever. So despite the fact that asthma can't be cured, it can be controlled with the right asthma management plan. So it's really important to work with your healthcare provider to create an effective asthma management plan, as most of these plans will help you recognize your symptoms and your triggers, and also provide information on how to treat your symptoms and avoid your triggers. An important first step in asthma management is to recognize when you might have asthma or are having an asthma episode. And this can be done by identifying your signs and symptoms. So again, common asthma signs and symptoms include shortness of breath, coughing, wheezing, waking up at night due to asthma symptoms, and or a drop in your peak flow meter reading if you use one. And so for those of you who don't use a peak flow meter or who aren't aware of what a peak flow meter is, it's a handheld device that measures how well air moves in and out of your lungs. And during an asthma episode, your airways, because they become narrow, it can be very hard to move air in and out of your lungs. So if you blow into a peak flow meter and you get a low reading, this could be indicative of the fact that you are having an asthma episode, even if you're not necessarily feeling symptoms. And the peak flow meter can measure the narrowing in your airways hours, sometimes even days before you actually have asthma symptoms. Asthma can be a serious disease, and it is important to see your healthcare provider for initial diagnosis and treatment, and also for ongoing asthma management. So untreated and uncontrolled asthma, it increases the risk of asthma-related hospitalizations and deaths, but it also can cause scarring inside the lungs or inside the airways. And this scarring, it permanently damages lung function, which can lead to the development of other respiratory diseases like a chronic obstructive pulmonary disease or COPD. So it's really important to create an asthma action plan in partnership with your healthcare provider. And this should be a written plan that has patient identification, information such as date of birth, and specific instructions on what asthma medications to take and when. And it's all based on asthma symptoms. And again, possibly peak flow readings if you do use a peak flow meter. And if you don't have an asthma action plan already, you can print one off on APA's Asthma Action Plan website at apa.org/action plan. So if you have asthma, it is important to keep track of your triggers. And because symptoms don't always occur right after exposure to your triggers, it might take a little bit of detective work to identify exactly what makes your asthma worse. And delayed asthma episodes, so they might occur depending upon the type of trigger and essentially how sensitive a person is to that particular trigger. But once you know your triggers, it is important to adopt multi-component strategies to reduce exposure or to manage them. And we'll discuss examples of these strategies on the following slides. So first, we'll talk a little bit about outdoor trigger avoidance strategies. So first, air pollution, we'll talk about that. Essentially, air pollution or small particles and gases in the air, they can pass through your nose or your mouth and get into your lungs and into your blood. And both long-term and short-term exposure to air pollution can cause many health problems. For example, it can increase asthma attacks, it can worsen your asthma, it can also damage your heart and your blood vessels and cause cardiac diseases. Additionally, long-term exposure can lead to adverse birth outcomes like preterm birth, low birth weight, stillbirth, and it can also lead to early death. So pollen is one of the most common triggers of seasonal allergies. And as noted earlier, allergies are a big trigger for asthma in a lot of people. And there are actions you can take to reduce allergic reactions to pollen. So first, try to limit your outdoor activities when pollen counts are high. And this will cut down on the amount of pollen allergen that you inhale. And it also can help reduce your symptoms. Another strategy is to keep windows closed during pollen season or peak pollen times. And also, if you have it, try to use central air conditioning or air cleaners with a certified asthma and allergy-friendly filter and or a HEPA filtration device to reduce indoor airborne allergens. Additionally, you can wear sunglasses and also cover your hair when going outside. And this keeps pollen out of your eyes and also off of your hair. And then you want to be sure to shower daily before going to bed. So this removes the pollen from your body and it also keeps it off of your bedding. And additionally, you want to limit close contact with pets that spend a lot of time outdoors. So one strategy is just to wipe furry animals off when they come inside, or if you can, bathe them weekly. Additionally, changing and washing your clothes that you wear during outdoor activities is really important. This also washes the pollen off. And then when you dry your clothes, be sure to put them in a clothes dryer or hang them up inside. Don't dry them on an outdoor line because this will just collect more pollen. And then finally, you just want to keep an eye on pollen counts and forecasts. So mold is a type of fungus that produces spores that float through the air, and it can grow on almost anything when moisture or damp environments are present, and it can be found both indoors and outdoors. So mold it's also a common cause of allergy and asthma symptoms. And mold seeds, which are also called spores, they essentially travel through the air. And when you upset a mold source, this can send the spores into the air. And this makes it easier for you to breathe them into your lungs, which can then trigger allergy and asthma episodes. But you can reduce your asthma and allergy symptoms by avoiding contact with mold spores. And some steps that can help include limiting your outdoor activities when mold counts are high. Also, remove leaves and piles of dead plant material or tree clippings as soon as possible. This is because mold tends to grow in dead plant material and tree clippings. Additionally, you might want to wear an N95 mask, hat, and sunglasses when you're caring for your lawn or garden. And if you can, try to have somebody without a mold allergy do your yard work if possible. And then finally, promoting groundwater drainage away from your house is important as well. Exposure to air particles in the smoke that's released during a fire can also irritate your lungs, and this can worsen your asthma symptoms. But again, there are steps you can take to help keep yourself safe. First, you want to track the air quality index in your area, and you can get current readings on airnow.gov. You can get it on weather sites and also on smartphone apps and from local news reports as well. Additionally, you want to try to keep your asthma under control as much as possible. So you may need to ask your allergist how you can prevent symptoms, and they might have you increase your medicines and decrease your outdoor physical activity as well. The air quality index is high. And then finally, working and exercising inside while the air quality index is high is important as well, if possible. That's because physical activity like exercise, it causes you to breathe faster and deeper, and this can pull more polluted air deeply into your lungs. But if you have to spend time outside, then it is best to wear the N95 rated mask. And this is because cloth masks and face coverings, they don't provide enough protection from wildfire air pollution. And when you are wearing the N95 mask, be sure to cover both your mouth and your nose and also protect your eyes. And then finally, you also want to improve your indoor air quality. So since you'll be spending more time indoors, it's equally as important to make sure that your indoor air quality is good. The polluted air, it can actually enter your home and get trapped there. And we'll discuss steps for improving indoor air quality in just a bit. So essentially, you want to be mindful of air quality and avoid spending a lot of time outdoors when air quality is poor, if possible. And you can visit the National Allergy Bureau at quadai or AAAI.org/NAB for pollen count information. Again, you can also visit airnow.gov for Environmental Protection Agency air quality alerts. And both of these websites, they also have apps that are available for smartphones and tablets. And additionally, local news reports often share pollen count and air quality information as well. And now I will move on to indoor trigger avoidance strategies.
We're going to talk a little bit about environmental triggers, things like dust, pets, and mold that Jessica talked about that can cause asthma and allergy attacks. And then they can be possibly life-threatening. We want to minimize exposure to those triggers and create a healthy environment if you have asthma and allergy. And so having good indoor air quality is a key component of this and essential for creating a healthy living space. So most people in the US spend about 90% of our time indoors, and our indoor air, believe it or not, can be 2 to 5 times more polluted than being outside.
Wow.
So we offer a free asthma-friendly home checklist on the website there at afa.org/healthyhome. It's in English and Spanish. And going through this can help you identify and reduce your indoor triggers. And if you're a renter, you can share this web page and printable checklist with your landlord if needed. And we'll talk about some general strategies for improving your indoor air quality with you today. Okay, so how to improve your indoor air quality and reduce triggers in the home. Cutting down sources of allergens and asthma irritants throughout your home is possible. Things like improving airflow in your home, so leaving interior doors open while running exhaust fans in bathrooms and kitchens can be a good strategy. Avoid harmful products. Things like pesticides and bleach and other harsh chemicals can trigger asthma and should be reduced as much as possible. Using those certified asthma and allergy friendly products, things that we know reduce allergens on bedding, using HEPA vacuums, cleaning products, things like that. Have a regular cleaning routine to remove dust, pollen, dander, and mold. Measure your home's humidity level. If you have moisture, try to keep it below 50%. You may need what's called a dehumidifier to reduce that moisture. Keep windows closed during peak pollen times, like Jessica mentioned, and also times of high outdoor pollution. Things like scents. So we love a good scented candle, but unfortunately, we know that things like scented candles or cleaning products can actually trigger asthma. So removing those from your home is recommended, and using things like battery powered ones. Carpets are a huge trigger potentially, so replace those if you can with solid surface flooring. Maintain your HVAC or furnace and air conditioning system, replace those air filters, use a portable air cleaner, air purifier in rooms where you spend the most time. Okay, so depending on where you live, obviously you all are in Ohio, there's going to be Ohio specific housing codes. And so it's ideal to for families not to be exposed to harmful asthma triggers. So by law, landlords are required to abide by state housing codes that protect people's health and people's safety living there. So this is just a quick snippet. You can check out your Ohio code at codes.ohio.gov if you're interested. And then local organizations like Ohio Healthy Homes Network may be a good resource to help. If you are a renter and you know that there are things in your home that are making you sick related to your asthma, here's some just general tips for talking with your landlord. We know that this can be overwhelming process for some, and people are worried about retaliation or losing the housing. So reaching out to a local resource if you feel like that's needed to help with advocacy, that should be available. But one general tip is to first talk about the issue informally with your landlord. A conversation via email, via phone, however that works for you. Then you can start, this also kind of helps document your timeline, ideally putting that timeline in writing so you have it. If that doesn't work, you can formally communicate in writing and outline your requests as well. If they ignore your requests, then you can notify your landlord that you may take further action if it's not resolved, and that you may have to, show proof that you tried to resolve it out of court. So definitely seek your local resources. I'm going to talk a little bit very briefly about AFA's resources. So that was a lot of information. Thanks for sticking with us. We are a national organization, but we do offer resources for anyone across the US. We have lots of resources on our free AFA store. We have a support center, which is a toll-free hotline available Monday through Friday, 10 a.m. to 3 p.m. Eastern Standard, except US holidays. We request 2 business days for a response. You can also email us, but if you have a question or need some guidance on how to live with your asthma, we can help with that. We have a couple online communities, which are online support groups that you can join. One is specific to asthma and one is specific to food allergies. We also have a learning catalog for families and patients, healthcare providers. We have some CEU opportunities if you have a credential that you need those opportunities. We have Ask the Allergist, which has some common questions about asthma and allergies that are our board certified allergists can answer some general information. But this is definitely not substitute for medical advice from your physician. And then we talked a little bit about our asthma and allergy friendly certification program. You can learn more about that and those products at that website. Lastly, wanted to let you all know, AFA has partnered with some program advisors and created the Black Women's Asthma Alliance. And part of that resource is a Facebook group that is specific to this community. It's for caregivers who may be taking care of others with asthma or people that live with asthma themselves. It's a private group. We'd love to have you join us. Just scan that code with your phone camera, or you can get directly to the group by typing in afa.org/join BWAA to get to that group. So love to see you there. Really quickly going to talk to you about some safe cleaning products. The EPA has a nice list of things that you can buy over the counter. Their Safer Choice program, it is a label that can help consumers identify what might be healthier and for your lungs to have in your home. And then feel free to take a quick picture of this. Here's some great safer cleaning recipes with just a few basic ingredients. You can create household cleaners that we recommend, and believe it or not, are very effective and very economical too. We are obviously not with you all in person, but you can reach us if you have any questions at programs@aafa.org. And I'm going to end the slideshow here. Okay, so it was great to meet everyone. Thanks for your time, and we look forward to seeing you on our online communities or any other space. And again, thanks to the hosts for having us, and we hope you found this beneficial. Take care.
Thank you. We appreciate the work of the Asthma
Hi,
and
everyone.
Allergy Foundation for providing that video of vital information. They talked about a couple of things at the end, and one of them is, this is our third evening of conducting these for the various counties. And one of them is about this whole thing around cleaning. And if you looked at a lot of the cleaning things that they showed you of how to make it up yourself, it included vinegar. So I don't know if you were like me, but if you remember growing up and going to family members' houses. For me, going to my great grandmother's house, I remember smelling the vinegar as she was cleaning windows or cleaning glass. We didn't have all of the things that we have right now. And so I think that even if we did have them, I don't think she would have used them. She was used to the things that she had. And so making sure that, if you're looking at those things to make them. But the other thing is, a lot of times we also will try to mix up things ourselves because we're like, oh, if I mix this and this, it'll be better. And so understanding the hazards of mixing different chemicals and different cleaners, particularly when you're in a household with someone who may be asthmatic. I remember years ago, I poured bleach into something. I didn't even remember that I poured it. And I think a few hours later, I put some Comet in there. And luckily, I was not close to it because when the fumes came up, I literally had to open up all the windows and go outside in order to air out the space. The other thing is during this time of year, a lot of us tend to barbecue. So we barbecue outside. Usually we have the windows in our homes open. And so when we're barbecuing, we're close by. We're close enough where we just walk out the house and can go to the grill. So that means that if you have someone in your house who has asthma, the fire from the grill, the smoke from the grill may cause them to have an attack. So you may want to make sure that if you're grilling, that you close off all the windows, and whatever clothes that you have on, that you remove them as you are going into the house, so that if you have children that are asthmatic, that they're not breathing all of those things in. We also talked about COVID and the fact that we have this COVID flirt variant right now, that we see a lot of people who are testing positive for COVID. And so because of that, the likelihood of them having some breathing difficulties is even higher. So you may have a person who has asthma and also they have COVID, and which means that when they're telling you that they really can't breathe, that they really can't breathe. We've also talked to some of the summer camps. And one of the things at summer camp is that they lock their inhalers into the nurse's office. And then when the campers need them, they go to the nurse. But a lot of times when they're out doing the nature hikes and walks, the nurse isn't there with them. So we talked to some of the nurses about making sure that the students have their inhalers with them while they're on their walks, and not only have them with them, but they know how to adequately use them. Those things were important. And then idling of cars, which we see quite often now, because when it's hot outside, we want to stay cool. So we usually have the car running with the air conditioning on, or also the idling of motorcycles. The exhaust fumes that are coming from the motorcycles may cause you to have some other types of difficulties. And the last piece is around rodents. They hit a little bit around this whole issue around having rodents in your house. But one of the things that's important is that a lot of times if we have roaches or bed bugs or other types of bugs in our house, we set off these bombs to kill them, but we close off the whole house. And then we're in the house. And so having a person who has asthma, it can exacerbate their breathing issues and may have to cause hospitalizations. So what we want to do is not do that at all. Hire professionals that are going to exterminate your house, and make sure that they're using things that don't have as much of some of these toxic chemicals as others. And they do have some that we have some exterminators that do natural processes. So for me, those were the bigger takeaways for you to make sure that I reminded you of. But the other is I want to thank the Ohio Department of Health, their asthma program, for supporting the Northeast Ohio Black Health Coalition's work. We could not have been here without them. And so because of them coming in and making sure that we had all the information that we needed, we're able to make sure that you get the information that we have. The last key finding for us to remember is that Black children experience asthma-related deaths at a rate approximately 14 times that of their white counterparts. Black children experience asthma-related deaths at a rate approximately 4 times that of their white counterparts. Black children experience asthma-related inpatient hospitalization rates at 6.5 times that of their white counterparts. Black children experience asthma-related emergency visits at 5.7 times that of their white counterparts. We have to do everything that we can to protect our children, particularly when their death rate is 14 times higher than their white counterparts. For African-American women, particularly adult women, African-American adults experience asthma-related inpatient hospitalization rates at almost 6 times that of their white counterparts. Black adults experience asthma-related death rates over 2.5 times that of their white counterparts. But adult women experience asthma emergency visits at a rate of 1.5 times that of men. Adults 65 and older die from asthma at a rate of over 2 times that of other groups. So asthma is a serious issue here in Northeast Ohio, particularly in Mahoning County, Lorain County, Cuyahoga County, the counties that we are focusing on. And because of that, we're here. Remember that if you want this book, if you want the information that's in here, to let us know. But we're also going to send you a video that includes all of the videos about asthma from all of the counties. So you'll receive the whole kind of packet of information so that you'll be able to use it also. And I think our last thing is, does anyone have any questions for us?
Oh, I don't have any questions, but I did want just to ask people to put their zip codes into the chat
Okay.
so I can have it for later.
Oh, you have to use the Q&A feature because the chat won't work.
Oh, okay. Thank you.
So I want to thank you all for attending this evening. Dr. Pugh, do you have anything before we finish?
No, I don't have anything. Well, okay, I do have one thing. I just hope that all of you who are participating today found some information that you can take with you. I hope you found the information to be useful and informative.
And we hope that you'll encourage people to attend tomorrow. Tomorrow we have a weekend virtual session that starts at 10 o'clock. From 10 to 11 tomorrow, we'll be talking about Cuyahoga County. From 11:30 to 12, we'll be focusing on Lorain County. And from 1 o'clock to 2 o'clock p.m. on tomorrow, we'll be talking about Mahoning County. And so this is an opportunity to tell people who were not here today that they can get some valuable information that they can share with their friends, coworkers, communities, and hopefully with the folks that are in churches with you, that you can share with your nursing staff at your churches. So thank you all so much. We appreciate it. Was there something in the Q&A? Nothing. Okay. All right. Thank you so much, and you all have a great evening.